Hello, I'm Dr. Laukkanen. I'd like to welcome you to another discussion about radiation treatment as it relates to breast cancer. And today we're going to talk about the question of, is radiation a good idea if a person has had initial drug treatment for breast cancer and when they have surgery, there's no sign of any cancer found at all? So we're looking at a case where a person's been found to have cancer in the breast, where they have not had obvious cancer in lymph nodes. They're treated initially with drug treatment, have surgery. The breast is conserved, that is, the surgery is some form of lumpectomy. And again, when the pathologist looks at any of the tissues that have been removed, there's no cancer in the tissue removed from the breast, and there's no cancer in the lymph nodes. So that would be called a complete response to neoadjuvant or treatment first, drug treatment first, neoadjuvant chemotherapy or systemic therapy. So, how do we look at the question, is breast radiation still a good idea? And the answer is not entirely clear cut. And to look at why we do something, usually it's because there's a policy that's been developed after doing a number of clinical studies. And sometimes we rely on traditions of what did we do before and what has worked well. Now, when we think about clinical trials, it can take a while to get answers for the most up to date therapies. And indeed, there are active clinical trials in progress looking at just the question that I've posed, but there isn't a hard and fast, proven answer. The traditional approach, if a person's had breast conserving surgery for an invasive breast cancer, is to add radiation treatment. So we might look at the features of an individual case to look at, would radiation be an easy thing, that is, a low cost insurance for them, or might they be in a situation where, uh, for a variety of reasons, there might be more risks or side effects from radiation? And importantly, it's an individual decision. A person has their own risk preferences and they make the choice that they're most comfortable to live with. So I'm just going to go over an example of a clinical study for which there isn't a final answer, but just shows how the question of, is radiation a good idea for the breast if there's no cancer found in the breast, how studies are looking at that. So uh, patients have breast cancer that's not locally advanced, it's not huge and bulky and fixed to the skin or chest wall. Um, there's no lymph node involvement, and the decision is made to treat them with chemotherapy as a first step, and then to have surgery, which is breast conserving surgery. And to be in the study, patients would be found to have no cancer whatsoever when that surgery was done. That is, the lumpectomy that was performed in the breast on the area where cancer was known to be present, there's no cancer there. And so the plan in this study is to follow patients that have no breast radiation and, as you might expect, to look at the outcomes, specifically how many of them have the cancer come back in the breast, say, in 5 or more years. Now, that study was started just last year, so it will take yet a few more years to get the results. So, how to decide? Well, if we think always of radiation treatment as an insurance policy, one looks at, oh, well, what does that insurance cost and what's my best guess of how much benefit I'll get from it? And so it's helpful to know what course of radiation treatment might be like, what the side effects might be like, and then to look at how, if one's denied, I don't think I'd like to do that, um, how one would feel about follow up and if something comes back to cross that bridge when we get to it. So some people prefer to say, well, if there's even a small chance that the treatment's going to help and it's not a big deal, I'll just go ahead and have it. And I'll just sleep better knowing I've done everything. And others say, no, if the drug treatment was able to get rid of a meaningful sized, obvious lump of cancer in the breast, I think it's a very good chance that it got rid of any tiny little bits that might be lurking in the breast as well. So I think that I'll just pass on it, and I feel pretty comfortable just having a set of checkups, mammograms, and the like. And as I say, I'll cross that bridge of recurrence if I have to, if I get to it. So that's just a quick summary of how to approach the situation of should I have breast radiation? If I had cancer in the breast, I had this neoadjuvant chemotherapy. When I had my surgery, there was no cancer there whatsoever. The last point I'll make is that many breast cancers have both an invasive part, that is infiltrating the tissues, and a non-invasive part where the cancer cells are just inside the ducts of the breast. And when they're just inside the ducts of the breast, that's kind of an earlier form. And the reality is that drug treatment doesn't penetrate into those ducts. They're kind of separate. And sometimes the thinking is, well, if I uh, don't do the radiation, I might miss some little bit of non-invasive breast cancer, and uh, radiation, if I have it, I have a good chance of getting rid of that. So it just gives an illustration of the fact that we don't have all the answers. So thanks a lot for your attention.